I'm Dr. Saranya, Consultant Maternal Fetal Medicine at Women's Center by Motherhood, Coimbatore. So in this video, we are going to see about few facts and misconceptions regarding diabetes in pregnancy. So the commonest misconception is that I won't get diabetes during pregnancy. So the fact is that every woman is at risk of diabetes during pregnancy. In our day-to-day practice, we see that every third or fourth pregnant woman is getting diabetic, either with the help of, either requiring diet, meal plan, or medicines or insulin. So the incidence of diabetes in pregnancy is about 25 to 30% in India. So who are at high risk of diabetes? Every woman is at risk of diabetes, especially when they are when there is a family history of diabetes, either in the parent or in the sibling or in their grandparents, when they are overweight or obese, and the age of the mother is more than 30 or 35, when they have a PCO before pregnancy. So what should be done? So ideally, like who are falling under these high risk category should have a pre-pregnancy checkup, that is before planning pregnancy. They should ideally consult a doctor, check up their sugars and see whether it is under control, and bring it to control before planning pregnancy. The second misconception, or like the second fact which is important, is the society or the family, how it is adding to the risk of diabetes in pregnancy. So whenever we visit a pregnant woman, we tend to give more sweets, snacks and cakes to the pregnant woman, so thereby they are at risk of having more sweets or snacks during pregnancy. So how the family or the society influences the diabetes in pregnancy? So whenever every relative visits a pregnant woman, they tend to bring more sweets and snacks that would easily tempt the pregnant woman. Easy availability of sweet shops, bakery, online food orders, that would also influence and tempt the pregnant woman. And the food practices in the family. So there are common misconceptions that the pregnant woman should eat for two, so they overload the woman with food. And like common misconception that only white sugar is unhealthy, even brown sugar or palm jaggery in excess amounts is also adding to diabetes in pregnancy. And the other misconception is millet based cakes or cookies are healthy, and like it is not so. Even the millet based cookies or cakes are also increases the risk of diabetes. So healthy food includes more fruits, vegetables, proteins, so which all are the healthy options. To be avoided are sugary foods, bakery items and the processed foods. The other pressure from the family is that every pregnant woman should take rest. They should be on bed rest, they should not walk, they should avoid exercises, which is totally wrong. So they should keep moving. Healthy exercises, stretches and mild exercises are recommended throughout pregnancy. This would help in controlling the blood sugars during pregnancy. So what can diabetes do to you and baby in pregnancy? So right from conception, control of sugar is important. So good control right from conception, control of sugar is important. A good controlled diabetes is like any other pregnancy, but when the sugar is uncontrolled, it can give rise to problems during pregnancy. During conception, when the sugars are high, it can result in miscarriage or abortion, and there are risk of congenital abnormalities, that is birth defects during pregnancy. So ideally, pre-pregnancy consultation and pre-pregnancy control of sugar who are at risk is important. And during pregnancy, diabetes adds to few other risks, which include extremes of birth weight. That is, like some babies are large for gestational age and some babies are very small. Diabetes can increase the fluid around the baby. So because of these risk factors, there is a small tendency that there is an increased risk of preterm labor, that is delivering the baby well ahead of time before the expected time. There is increased risk of cesarean rate during labor. Not all diabetic women require C-section, but there is an increased rate of C-section among the diabetics. And there is something called unexplained intrauterine fetal death, so which is like baby's heartbeat stopping for unexplained reasons. So proper control of sugars during pregnancy is important. So when the sugar is well controlled, the risk of complications during pregnancy and labor is reduced. During labor, again, there is something called shoulder dystocia, which is like problem in delivering the shoulder of the baby. So when the sugar is uncontrolled, there is excessive fat deposition over the baby's shoulder, which could result in difficult delivery. And what is the risk for the mother? The mother is at risk of diabetes in the future. And what is the risk for the baby after delivery? Immediately 24 to 48 hours after delivery, the baby's sugar can fall down, so which is called hypoglycemia. So monitoring and correcting the sugars after the delivery for the baby is important, and the baby is at risk of diabetes in future. So increased awareness about diabetes in pregnancy is important, for which the pregnant woman and the family should be careful right from the conception and take enough measures till pregnancy, delivery, and after that also. What will happen to diabetes after delivery? So we say the most of the diabetes in pregnancy gets normal immediately after delivery. So 90% of women have normal sugars immediately after delivery, but 10% continue to be diabetic. So it's not all over after delivery, they have to follow it up after delivery. So we recommend testing sugars 6 weeks, 6 months, and every year after delivery, because all these women are at risk of diabetes in the future life. So they should monitor and follow the healthy lifestyle practices even after delivery.